Let's talk about the nursing process and how you can use it to answer prioritization questions. If you like my content, please subscribe, like, and share. The nursing process has 5 steps: assessment, diagnosis, planning, implementation, and finally, evaluation. Let's dive briefly into each step. The nursing assessment. This involves gathering subjective data in the patient's own words and objective data such as vitals, labs, and nurses' own observations. During exam, you can underline what data is given and separate subjective from objective data. Diagnosis. In this step, the nurse will identify nursing problems, not medical problems. There is a difference between a nursing diagnosis and medical diagnosis. A nursing diagnosis may look like this. Patient John is at risk of DVT as evidenced by prolonged bed rest or immobility. Medical diagnosis will sound like this. Patient John has DVT. Patient John has heart failure. You can always prioritize your nursing diagnosis in order of priority using the airway safety, breathing, circulation, and disability format. Nursing planning phase. This is coming up with goals. Your nursing planning and the goals must be SMART goals: specific, measurable, achievable, relevant, and time-bound. Exams often ask for short-term versus long-term goals. Keep them realistic and SMART. Implementation phase. At this step, the nurse will carry out interventions which can either be independently, that is nurse-led, or dependent of the physician's orders or collaborative with other team members. Always make sure your interventions matches directly to the diagnosis and goals set in the previous steps. Evaluation phase. This is where the nurse will check if the goals were met, either partially met or not met. Always look back. If the goal was not met, reassess and revise the plan. Other exam tips. Think stepwise. From assessment, then you go to diagnosis, then you go to your planning, then you go to your intervention, and then you come up to your evaluation. Don't jump into intervention before you assess your patient. Prioritize safety and airway. And then it's airway safety, breathing, circulation, and then disability. Read the STEM question carefully. Identify what stage of the process the question is testing. Apply the correct step. Don't plan before you assess. Thank you for watching. Please subscribe to support my channel, share, like, and comment. See you on the next one. Bye.